Hello, everybody, and welcome to our latest Strove webinar. Today is a very interesting session and lifts the lid on an exciting feature update and enhancement that we've released into the app and the community fairly recently. And today's session, we are joined by Dr. Jared Van Zaydam, who is our Chief Medical and Innovation Officer. He's a sport and exercise medicine physician. He's been at the heart of all of our sort of clinical innovation, feature updates, and all the health and clinical things that go into Strove app since day dot. And this is one of the recent ones that hopefully you've all played around with. And if not, today will be a good opportunity to go test it out. It is Health Mirror, which is how we are getting or helping you guys get some data on some health metrics. And Jared's going to explain it all to us, how it works, the technology behind it, and how we're using something as sort of regularly available as your cell phone to help you get a better understanding of your health. It's been quite fun. I've been playing around with it as well and testing it. I'm sure, Jared, you're going to let us know sort of best use cases for this, but it's been quite fun to see sort of as you're exercising a bit more, how it might change things, some of the readings, even sort of some regular meditations and seeing if it impacts anything there. And for each of us, there might be a use case that we can see how it applies to ourselves. And if we can at least get some eyes on our health markers and what we can use those for. So I'm going to hand over to Jared, who'll run through today's session. Guys, please feel free to ask any questions into the chat, and we can swing it back around to those at the end. Jared, over to you.
Thanks, Adrian. Yep. Afternoon, everyone. And yeah, as Adrian said, we're kind of going to do a little brief introduction to some new technology in the app that we're quite excited about. Essentially, it allows you to measure some vitals from performing just a selfie video on your smartphone, which is pretty incredible. But we're going to sort of dive into how it all works and when you should use it, what it's good for, what it's not good for, and then we'll open up to some questions at the end and see if there's any feedback from you guys. So, without further ado, we'll start by diving straight in and showing you how to actually access the feature and do it. So, from your menu, just click the plus icon, and then there's a little menu item there called Perform Health Check, and that'll get you going to the flow. There's a bunch of other cool stuff in there as well, including one of our other AI features, the meal logger. So if you haven't checked that one out, please do. The health check scans are unlimited, which is something new for us. We've been playing around with this technology for a little while, but we're at the point now where we've opened it up to all Strove users, and everyone gets unlimited scans. So you can kind of use this at different times of the day or in different situations and experiment with it as you go. So once you are through that once you found the feature, you're going to go into a little pre-scan survey that's going to ask you some questions. So on your first use, it's going to ask you your height. After that, we kind of assume that you're not growing anymore or shrinking. And so you'll just need to put your current weight in, and then it asks you a couple of other questions, including some basic medical history and medication history. And this helps us to kind of personalize your results and your recommendations. And then some of the risk scores use factors like age, sex, BMI, smoking history, and family history to fine-tune those readings. So it helps the system separate normal variation from patterns that are actually worth paying attention to. And the more times you do the scan, the better your results will be in terms of the hypertension risk and a couple of other things that you'll get back. So please answer that survey accurately, and the more accurately you answer that, the better your results will be. Then when you actually perform the scan, there's a couple of things you need to do. So just make sure that you place your phone on some sort of tripod or lean it up against something, so that it's more or less at eye level and it's stable. It's not moving at all. You should be sitting, and you should be, calm, having, sitting for at least 5 minutes or so, breathing calmly. And then just avoid talking, avoid moving during the scan, and make sure that your face is well lit with sort of even lighting on your face. You don't want any strong backlighting, sort of a bright window in the background or any shadows, flickering light. That's going to mess with the algorithm. Obviously remove, sunglasses or anything covering your face, and just stay relaxed and breathe normally. The screen will guide you in terms of where your face should be, and it takes less than 30 seconds. It's really quick, and the screen will guide you and let you know if a successful scan was performed. Then it's going to dump you on your results page, and you can explore those, have a look at your readings. We are working on some enhancements to allow you to kind of track your data over time, to graph that data for you, and just make it a little bit easier to kind of understand how everything fits in and how your trends are going. Also, this data feeds into your Strove score, so that's kind of the main spinner on your dashboard there. And so doing this scan is essential, at least once a month, is essential to get a valid Strove score there. And the better your Strove score, obviously, the better your rewards tier is. So we kind of reward you for doing these. A little disclaimer that some devices are not supported yet. So, if you have a Nokia 3210 still, unfortunately, that's not going to work. We require kind of a minimum quality of camera to be able to pick up some of the changes that the algorithm is based on. Also, there's a little bit of a disclaimer with Huawei devices, and we're working on that to try and make sure that Huawei devices can also use the scan. But compatibility is quite broad. Most people with a smartphone bought in the last 4 or 5 years should be able to use the feature. So, like, my first reaction when I saw this technology was one of kind of disbelief. So if you're like me, I was sort of quite skeptical about how this all works, and how it's actually possible that a simple selfie video can give you this kind of health data. Although maybe in today's modern times, we're not all that surprised when technology comes out with something new, but this to me was really interesting. So let's have a little look at kind of how this actually works. So it's based on a technology called remote photoplethysmography, or remote PPG, which is the same technology that is in your smartwatch or wearable. So there's little green and red lights on the back of your smartwatch. They are using that's the same thing. That's PPG, and it's using that technology. But this is slightly different. Obviously, it's remote, so there's nothing touching you. It's based on the camera. So essentially, the camera is watching your skin, and it records a short video of your face. And then the software identifies specific areas in your face that are stable. So usually on the cheeks, under the eyes, there's a couple of other areas that the AI focuses on. And then essentially with each heartbeat, there are tiny little color changes under the skin due to little blood vessels that fill with pressure as the heart pumps. And that tiny change is actually measurable by modern smartphone cameras. They're obviously too small to see with the naked eye, but the camera actually does capture those tiny variations. And usually the green channel is the one that carries the strongest pulse signal. So there's an algorithm then over the top that cleans up the data and extracts a pulse algorithm from that data. And then using the pulse algorithm, we can estimate vitals. So heart rate is probably the easiest one to estimate there, but we can also decipher breathing rate and blood pressure and HRV from that as well. So that's in a nutshell how the technology works. So it's not magic or hocus pocus. One of the common questions, obviously, is, this is great, but is it accurate? And the answer is that it's reasonably accurate, actually. So for heart rate measurements, there's a strong agreement with reference devices. So the mean error there of around 2.1 beats per minute, and 92% of readings are within 5 beats per minute. Respiratory rate, also good agreement with chest belt sensors. HRV, which is heart rate variability, also has strong agreement. The mean error there is around 13 milliseconds, and almost all measurements will be within 40 milliseconds of a gold standard device. Blood pressure is obviously a lot trickier to measure, but the algorithms are getting better at providing an accurate blood pressure estimate from this as well. So for systolic blood pressure, that's the number at the top. It's within around 10 millimeters of mercury of the true value, and diastolic is slightly more accurate. It's at around 7.2. Again, best results really depend on good lighting, a visible face, and staying dead still, and obviously the correct phone position and all those things that we spoke about. The fine print, this is definitely not something that replaces your trip to the doctor. It's not something that should be used for diagnosing or managing medical disease. So it provides general well-being insights, and abnormal readings should be confirmed and validated with medical equipment. And yeah, I mean, if any of your readings are out of range, it's a good idea to speak to a healthcare professional. So absolutely don't panic if any of these readings are high. It's really the whole idea with this tool is to allow people to perform these measurements more often, so that they may get an early warning sign and a reason to actually book that appointment with the GP that you haven't had for 5 years or whatever it may be. So yeah, for wellness use only. Another common question is obviously around privacy. Whenever you are sharing photos of yourself or videos of yourself, that's a big concern. So we can reassure you there, your face video is processed securely and then deleted immediately. So nothing stays on the database. We don't store those videos at all. And the measurements are then linked to a unique identifier, a reference number, so not to your name. The photos and videos no photos and videos are stored after processing, as I mentioned, and those pseudonymized measurement results are retained. So privacy essentially is protected throughout the process. Okay, we're going to go through just what you actually get back in your results and how you can think about and use those results. So the first one you'll get back is heart rate. I've put in brackets resting because this is not, you shouldn't really be using this straight after you've gone for a run. We're really trying to decipher what your resting heart rate is. So it would be a good idea when you use this feature to try and use it at a similar time in the day, under resting conditions. So usually, after getting up, sitting down for a little while before your morning coffee, that's a good time to take these readings. And essentially, it's going to measure how many times your heart beats in a minute. So normal resting values are usually around 60 to 100. That's what's quoted essentially, and that's what your doctor will consider normal. but it's lower is better in general. So as you get fitter, as your cardiovascular fitness improves, your resting heart rate actually goes down. And so the fittest athletes in the world will be sitting at resting heart rates in the 40s and sometimes even in the 30s. So getting below that 60 is no reason for concern usually. And if you're someone who's exercising a lot or fit, it's pretty common to have resting heart rate values in the 50s. 100 beats per minute, on the other hand, is quite fast. So someone who has a resting heart rate of 100 beats per minute, even though it's considered sort of borderline normal, it's quite high, and there may be a lot of lifestyle changes that you can make to bring that down over time. We've essentially only got a limited number of heartbeats in our lives, so let's not waste them with a rapid resting heart rate. Often higher readings can reflect, exercise. Maybe you've had an exercise session that morning and you measure sort of half an hour afterwards. Your heart rate will likely still be a little bit raised after that session. Stress is definitely something that we've all experienced, raising the heart rate. Before your presentation, you can feel your heart beating in your chest. Caffeine is a common one, and all of us are probably consuming a little bit too much caffeine on a daily basis. Illness, it's one of the early signs of getting ill, essentially. So sometimes you'll wake up, check your resting heart rate, and it's 5 beats higher than it normally is. And sometimes that's a sign that there's a viral illness or something heading your way. So that's a common cause of a slightly higher resting heart rate. Dehydration as well, not rehydrating after exercise or not drinking enough can cause a raised heart rate, and poor sleep as well. As with most of these measurements, it's important to focus on trends. So don't fixate on one abnormal reading. You've got unlimited readings. Repeat it after resting a little bit, and have a look and see if it improves. And then track trends over time. As I said, we're going to be releasing a bunch of updates to help you do that. Obviously, if repeatedly high at rest and really not coming down, or unusually low, or linked to some sort of symptoms like breathlessness, or feeling your heart beating rapidly in your chest, then absolutely that's a good reason to seek medical advice. HIV, this is one that's not well understood on the most part. It's become very trendy with the popularity of wearables and things like Whoop bands and that sort of thing. And essentially, it stands for heart rate variability, and so it measures the variation in the beat-to-beat time. So in other words, if you have a look at an ECG like that fake one on the wall there, they're measuring the time between peaks in that ECG. And a high variability is good. So that generally shows that your autonomic nervous system, the system that governs how quickly your heart is beating, is healthy and regulating that heart rate. So numbers, some athletes will have HRV numbers in sort of 100 plus. It declines as we age. And lower values can reflect, stress, poor sleep, illness. Alcohol is a big one. Alcohol really knocks HRV, really heavy training or overtraining or just general fatigue. It's super important here to not get fixated with the number and not to compare your number to, your wife's number or your buddy's number. There's no normal here. So for resting heart rate, we say 60 to 100 is normal. HRV doesn't really have a normal range because there's such wide variability in different people. So don't get fixated on that absolute number, but do have a look at your own trends and try and understand how those trends move over time. And also try and measure this at a similar time each day. So as I've said with resting heart rates, first thing in the morning is a great time. And then you can track that number over time. Also take note of certain, lifestyle practices that affect your number. You may realize that if I have, 2 beers the night before, my HRV slumps by, 20 milliseconds the following day. And that's a pretty common cause. And one of the main outcomes with Whoop, which is, a big company that bases their whole thing around HRV, is that a lot of people are actually lowering their alcohol intake or quitting alcohol altogether just because they realize how closely linked alcohol intake and HRV is. But poor sleep is another one. Lack of sleep is something that also knocks your HRV. So yeah, it can be a sign also to focus on recovery. You might wake up one morning feeling a bit tired and notice that the HRV is really low, and maybe that's a sign that you should try and take it a little bit easier that day. If you had training planned, maybe you make that an easier session or skip it altogether. Blood pressure. So this is probably the one that's most important for your cardiovascular risk. So as we know, hypertension, which is high blood pressure, is one of the leading risk factors for cardiovascular disease, so stroke, heart attack, and all sorts of other things. So essentially what's estimated here is the pressure in your arteries as your heart squeezes and as your heart relaxes. So systolic is when the heart is squeezing, and diastolic is when the heart is relaxing. Most of us know that blood pressure can be affected by a bunch of external factors. So stress is a big one there, caffeine, physical activity. In the short term, in the long term, physical activity actually lowers blood pressure. Pain, and yeah, poor measurement conditions. So I mean, there's a variety of things there. There's also something called white coat syndrome. I'm sure some of you may have experienced. It's every time you see a doctor and he walks towards you with a blood pressure cuff, your blood pressure seems to shoot through the roof, and that's a well-known phenomenon. And this tool can actually help in kind of getting around that. It's much less nerve-wracking to stare into your own cell phone than it is to have a big cuff squeezing your arm and a doctor staring at a dial. Again, treat this really as just a wellness estimate on blood pressure. It's certainly not a diagnosis. We would never start treatment based on a reading from the scan, but it really might be an early warning sign that if you haven't had your blood pressure checked in a long time, maybe it's time if you're getting repeated high readings on the scan. Always, if you get an abnormal scan, then just repeat it under calm conditions. And if it's still high, then yeah, head to a Clicks, head to a Dis-Chem, head to your GP, and just get it validated with a blood pressure cuff. Super high results, then yeah, perhaps it's prudent to visit the doctor a little bit more urgently. There's also a separate reading that you'll get called hypertension risk. And this risk is talking about your risk of developing hypertension or high blood pressure over the next year. So it uses the blood pressure reading, but it also uses some of the risk factors that you put in the pre-scan survey. And it doesn't just use one reading, so this will improve over time the more you use the feature. And essentially, it will classify you into 3 risk categories. Low, meaning that your risk of developing hypertension over the next year is less than 5%. Elevated, if your risk is between 5 and 10%. And in the high risk category, you're looking at more than 10% chance of developing hypertension over the next year. So again, it's just something that might serve as an early warning signal and a reason for you to go and have your blood pressure measured in a formal setting. Respiratory rate is another one that you'll get back. It's pretty self-explanatory. It just measures how many breaths you take per minute. And again, this should be measured in the resting state. If you just come back from a run, yeah, I mean, your respiratory rate is likely going to be in the 40s or 50s. But at rest, a normal value is around 12 to 20 breaths per minute. High readings, of course, again, stress, recent activity, fever, pain, or some sort of breathing difficulty. Retest if it's a little bit high, but essentially this is likely going to be normal in most people. You can feel if your respiratory rate is high, if you've got respiratory distress most of the time. Yeah, I mean, if you do get a high reading, it might be a respiratory infection, but there's a couple other things that could cause this. But for the most part, most of you will have a normal respiratory rate when testing. Okay, so those are sort of the numbers you'll get back and how you can think about them. Then there's kind of the why, like why is this important and why should we even bother? And as I mentioned, one of the biggest things here is really to be able to spot changes early before they become a bigger health issue. A lot of people are walking around with hypertension and sometimes really, really severe hypertension without even knowing it because there are no symptoms. So this is an amazing tool just to really check up on some of your vitals. If you use it once a week, once a month, that's already a huge step forward. Most patients will only check their blood pressure, once a year when they do a medical, and sometimes not even as often as that. It also can help you understand your body's patterns across, different lifestyle habits like sleep, stress, recovery, alcohol, that sort of thing. So by kind of thinking about which lifestyle patterns are affecting your results, you can try and then eliminate or add different practices to try and move those numbers in the right direction. It can also then obviously help you make better daily decisions about, rest, training, hydration, and stress once you know how those things are affecting your numbers. Again, really focus on tracking progress over time, not just one-off readings. I think we'll all get the occasional one-off reading which will be off, and that's okay. Just repeat that and track your trend over time. If if you're not returning to normal ranges, then it might be time to seek medical advice. But if any of the readings are associated with symptoms, then yeah, heading to the doc sooner rather than later is a good idea. Yeah, that's about it. Short and sweet, but maybe we can open it to some questions and see if there's anyone wanting to know any more.